Hey guys, it is Sarah, and today I'm going to teach you guys how to change a G-tube button. So G-tube goes by two different names, G-tube or a PEG tube or a gastrostomy tube. So that's what the G stands for, gastrostomy. PEG and G-tube are the same thing, essentially. PEG stands for percutaneous endoscopic gastrostomy, which is the method in which the procedure was performed, right? So percutaneous is skin, endoscopic is going in, and it's guided by the endoscope. So gastrostomy. So still it's a G-tube, it's just the way it was placed, okay? The stoma, I just want to teach you guys a couple things. The stoma is the hole in the body, okay? The hole that is created is called the stoma. This is called a button, a G-tube button. They can also just have the tubing coming out from the stoma, but buttons are very, very easy. Buttons are held in by a water-filled balloon, and in the balloon you only want to use clean water, no tap water. You can use bottled water, totally fine. Sterile water is preferred, or distilled water, but like I said, no tap water, because you don't want to put kind of like the bacteria and electrolytes and all the stuff that could break down or harm the material or your loved one. So I do actually need to give a little disclaimer, right? Because I love making these videos, but I do not want to get my behind in trouble. So I need to let you guys know that these videos are for educational purposes only, right? I'm not giving medical advice to anyone. I just love to show you guys how easy something can be, and kind of hopefully take the fear out of some nursing school things, or you know, maybe some things you have to do to your loved one and you're kind of hesitant or have anxiety about it. Hopefully I can help relieve some of that. So to change a G-tube, the first thing you want to do, obviously, wash your hands, right? You want clean hands. You can wear gloves if you'd like. You do not have to. If you are at home and changing a loved one's G-tube, you can, you know, like, again, just make sure you have clean hands. In a hospital clinical setting, you want to wear gloves. So the very first thing you want to do is, in your kit to change your G-tube, it comes with a little kit. You'll have everything you need. So it's just a 6 ml syringe. So typically, if I didn't say it already, the balloon holds 5 mLs. That's usually how much it holds. So you're going to just push the syringe in. You're going to pull the old water out, give it a little twist, and it kind of helps make the syringe come out without making a mess. Though I did right here. It's whatever. So again, 5 mLs, okay? So you're going to discard the old water, and then you're literally just going to pull straight up, okay? So this is the HOMA, the stoma, the hole/stoma. HOMA could be the new name, I don't care. Here's what the button looks like when it comes out. But obviously when it comes out, do not be alarmed. If it has been in there for quite a while, even if it hasn't, it depends on how much stomach acid is in the patient. This will look brown or possibly a little green. It'll look broken down, yellow. It won't be cute. It will not be pure like this. So do not be alarmed, please. Now I want to show you kind of what will happen, okay? So when this is inside of the body, so you're going to push it in, okay? And then you're going to put the 5 mLs in. Now see the balloon? Okay, I had more in there, so that's why I stopped. But the balloon is what holds it in place. So say this is your skin. See how it's right there? So the balloon sits right below the skin. So if you were to tug on it, it will not come out. So that's how it stays in place. Again, take the water out, discard it. So when you pull it out, you may or may not, but you probably might, get some stomach content coming out of the stoma, perfectly normal. So you're just going to obviously clean it, wipe it away. You can use some saline, but it comes with, your pack will come with gauze. So you're going to do that. You can even give it a little press around to let any air come out if need be. You will get lubricant, so cut your lubricant. you can pour the lubricant into the little, like the little package it comes in. Dip your new button into the lubricant. You can go straight here, one and done, toss this, or dip it into the package. It doesn't matter. Just get lubricant on your button, okay? Then you're going to simply push it right back in. You see the stomach? I drew that last minute. I hope you like it. Okay, so push the button back in. You're going to take your water, bottled water, sterile water, distilled water. You're going to pull 5 mLs, okay? 5 mLs. Then you're going to push it. You have to, and see, the thing is, when you, let me zoom in, I want to show you guys this part. When you push in, it kind of like releases a little flap that allows you to fill. So you're going to just push the water in, hold it, twist to pull out so you don't make a mess. Okay. Then you can give it a tug and it's in there. Okay. And it's okay if there's space between the skin and the tube. Sometimes it is completely flat against the skin. If the patient hasn't eaten for a while, it can even be a little sucked in, or they can be slack, and that's okay. It's okay. It should be able to twist and move. It's all good. All right. So then after you place the new tube, you're going to open the flap. It's just like, hold on, let me move my camera. So it's like a beach ball, kind of, really, with a button, a G2 button. So close it, pull it open. Also, you will see on this, this is called a Mickey button. You will see that it locks. Do you see this line, this little black line? So syringes, not syringes, I'm sorry. This is called an extension tubing, okay? So the extension tubing will also have the black line. So you want to connect those lines, right? Make sure they meet up, and then give it a twist, and it locks the extension tubing into place. So it cannot be tugged or pulled. All right, I want to just make sure I'm kind of giving you guys the breakdown. I'm sure I'm forgetting something. In your kit, you will have a syringe. So this is, I call it a bullnose tip. It will fit right in to that. However, most places that I have known for my own child and, you know, in the hospital setting, most places are switching to what's called an in-fit type of tip. And you can see it screws. So if you have one of these extension tubings, but you only have an in-fit, hopefully you have one of these. This is how that works. So you put that into the tubing, then you can screw that on, okay? So after you place your new G-tube button, you can gently press around to get some return, some stomach content return. Or, oh, that's the lock, by the way, right? So this locks it into place. Or you can, where is my, there it is, the plunger. I wanted to show you. So you can also, after you place a button, because we want to make sure that it's in the right place. I don't have a pH testing strip here at home, but what I do, because I changed my daughter's, so after I place it, I will just gently pull back a little bit. I mean, very, very slowly, because obviously things can collapse in there. So just very, very slowly, just a little bit, pull back. See if you get any stomach content. If you do, push it right back in, close it, and you are good to go. Gosh, I know that I have not answered something. I hope that I have. Okay, so this should not, if it's an older button, this should not be painful to change. If your loved one is, you know, if they don't speak, if they're non-vocal, and can't tell you, just know that this should not hurt when you're changing it. It can be uncomfortable. It can feel a little odd, but there should not be any pain associated with it unless there's a problem. Also, around the stoma, you can get what's called granulation tissue, which is just kind of pink, raised, inflamed tissue around the stoma. And I'm not sure if I should recommend, because going back to that whole, I don't want to give medical advice, but there is a very, very easy cure. Most of the time it works beautifully. So if you do see pink raised tissue around the stoma, simply ask your loved one's doctor and they can guide you from there. Okay, if my content was helpful for you, I would love and appreciate so much if you would subscribe, if you would share, engage with me. Tell me what you'd like to see. Tell me if I helped you. Hopefully I did. If I did not, let me know that too. I will explain it a different way. Alrighty, take care. Bye, guys.